Yeah, Joe.
You did.
If you want, I can forward that to you, or I can ask it myself.
Sounds good. Yeah, yep.
Thanks.
You're a good sass. It's settled with asking questions all the time. I approve of that question.
Okay. That was the courtesy I was trying to extend.
I know, and I appreciate that. It plays into
Yeah,
it so
I'm
much.
just
Yeah, well, I figured.
I hope you're not allergic.
I was gonna pay attention.
Not that much. Do you want to anything?
That's been, that you might have extended vacation or something.
I was on a week ago.
Yeah.
Nothing extended.
I'm ready, if that's what you're waiting for.
We got 2 minutes.
Oh, there's still a couple minutes? Oh.
Someone feels
I thought it was like
special.
right on the line there.
Good morning. I've used this time before to talk about the opioid crisis that is ripping apart families here and across the country. And today, on International Opioid Awareness Day, I'm going to use this time to talk about the challenges we continue to face when it comes to overdoses. More than 107,000 Americans died of a drug overdose in 2021, a record in the United States. This day serves as the world's largest annual campaign to bring an end to this crisis, an end to the stigma that comes from dying from an overdose, and also to acknowledge the grief and the loss of a loved one from an overdose. To honor those lives lost, I encourage everyone in the St. Louis County community, residents, businesses, and any organization to wear purple today to share this important message with your family, with your friends, and your coworkers. Doing this is a small way to recognize and honor those who have been impacted by substance use, as well as their loved ones. Substance use continues to be a major public health crisis in St. Louis County. The COVID-19 pandemic has contributed to an increase in overdoses and deaths, and the easy availability of the synthetic opioid fentanyl has made substance use even more deadly. There were 343 opioid-related deaths in St. Louis County in 2021, tying 2020 for a record number of deaths. Overdose deaths from all substances reached 490 in 2021, up from 455 the year before. And fentanyl, which is 50 times more potent than heroin, was a factor in the majority of those deaths. Also in the county's health department, we've documented a growing disparity in overdose deaths, with African American men far more likely to die of an overdose than any other group. And last month, the health department released a new substance use action plan, a comprehensive, broad-based strategy to combat substance use over the next 2 years and beyond. The plan has been created over several months' time with the help of various community partners, and there are 5 key goals in the plan. First, raise awareness about substance use, overdoses, and how the community is affected by them. And that's what we're doing here today. Number 2, prevent opioid use disorder and other substance use disorders. And prevention is what I want to stop and talk a little bit about right now. Throughout the region, various governments and agencies have taken on the challenges of opioid overdoses. I've talked to Mayor Jones about this issue, and we're both deeply troubled by the crisis that's killing so many of our residents. The most successful approach is a regional approach, one where we can work together, pool our resources, align our priorities, and reverse this disturbing trend. While we do not have details yet to share, we do know that elected regional leaders and regional health departments must sit down together, work together, and find a way to stem this tragedy. And I anticipate that Mayor Jones will have more to say about this later today. What we do know is this: no county or city is immune from the crisis. It impacts every race. It doesn't matter where you live, in the suburbs or the city, or whether you're rich or poor. It affects our teenagers, our sisters, our brothers, our spouses, our parents, those we sit next to at weekend services, and those we work beside in the office. One way we can help is increasing the availability of Narcan to rescue people during an overdose. And Narcan availability is the 3rd goal of the county's substance use action plan. And those efforts are already underway. We provide Narcan for free at our public health centers, no questions asked, and we offer it to those who are released from our care at the Justice Center, where we're seeing more and more detainees coming in with substance use challenges. The 4th goal of the plan is connecting more people to treatment with a focus on high-risk populations. And that gets me back to the regional approach that Mayor Jones and I support. Not only must we make treatment more accessible, but we must make sure that we're reaching the populations hit the hardest. As I mentioned earlier, African American men are far more likely to die of an overdose than any other group. And the 5th goal is this: increase access to recovery services that increase the quality of life. And this will take work. Establishing a standard of care across the state and across the U.S. has not been a success. Recent studies suggest that the focus on care should be more to connect patients quickly to medical care than to counseling. People are much more likely to survive on prescription medications such as buprenorphine or methadone, which is used to curb addiction. The plan that the Department of Public Health released last month came with input from nearly 40 partners, including the St. Louis City Health Department. And as we deepen our partnerships and work with the city and other counties in the bi-state region, we do so with a commitment to increase treatment and prevention and saving more lives from overdose. In St. Louis County, we have an opportunity to amplify these efforts by dedicating $48 million in opioid settlement funds to treatment and prevention programs. And before I open it up to questions, I'm going to sign a proclamation declaring today International Opioid Awareness Day in St. Louis County, in hopes that this too will draw attention to the crisis. Okay, I'd be glad to take any questions.
There's been reports that the county morgue is overcrowded with opioid and overdose deaths, and the county is paying money to funeral homes to house dead bodies. With your plan to reduce overdose deaths, cancel the need for the new morgue, or do we still need more morgue space?
No, our question is about the morgue and do we need more morgue space, and I'm sure that will continue. We are now using temporary trailers in the county health department parking lot to store bodies. The morgue is overcrowded. We really don't have an option other than to build more morgue space. It's going to take some time to reverse this trend. We hope that the interventions will slow the trend down and take it in the other direction. But unfortunately, we're going to need more space in our morgue. And we hope that we'll soon have the funds released to do the study and start moving forward with that plan.
Now, a couple years ago during COVID, you guys put in, I guess, was that a temporary morgue? It was on an Easter Sunday.
Yeah.
Gosh, for-
Yeah, so during, the question is about the temporary morgue during COVID. So during the beginning of COVID, we all watched with alarm as COVID was sweeping through the coasts, and some of the other parts of the country were struggling to store the bodies. We saw them in other parts of the world being unfortunately moved around with forklifts, and it was an alarming scene. We worked quickly here in St. Louis County to set up a regional morgue, temporary morgue, and we fortunately, because of our interventions and because of the actions of our community, that temporary morgue did not see a lot of action from COVID. That facility is no longer available. It's been, the lease was turned over a long time ago, many months ago, more than a year ago, and it's no longer an option. What we need is a permanent facility in St. Louis County. We've really needed this morgue space for some time. St. Louis County handles medical examiner services for other counties in the region through a cooperative agreement. And in addition to the temporary trailers, we're now storing bodies at funeral home here in the region.
Anybody else? All right, thank you.
Okay, thanks.
Yeah, I can remember if that was a temporary morgue or,
Yeah, I think it was.
I remember my brother had that. Easter Sunday. Yeah, it's the only reason I remember.